Today, we're diving into a really powerful NTV Kenya investigation that looks into Systo Mazoldi, a faith-based hospital in Nakuru County. And I have to tell you, this is a deeply disturbing story. It's about alleged medical negligence, some really elaborate fraud, and the incredibly brave people who risked absolutely everything to bring the truth to light. Let's start with these words from Amos Kiprop, a radiographer who became one of the whistleblowers. This quote right here, it just cuts to the very heart of the story, right? It's about a professional oath to protect people clashing with a system that was allegedly doing the exact opposite. And it was that fear for someone else's life that got this whole investigation started. So this is the institution right at the center of it all, Systo Mazoldi Hospital. It was founded by Catholic missionaries, built on principles of faith and care. And it's that very foundation, that trust people put in them, that makes what comes next so profoundly shocking. Now, this story doesn't begin with data or policies. It begins with a person, a 24-year-old expectant mother named Agnes Chalangat, and the absolutely tragic timeline of her final day. You know, Agnes was so excited to welcome her first child, and she specifically chose Systo Mazoldi because its Christian mission was in line with her own faith. She placed her trust and the life of her unborn baby right in their hands, believing it was a place of compassion and care. So take a look at the timeline of Agnes's last day. She's admitted at 10 in the morning and she's in the operating theater by 4:30 p.m. But here's the crucial moment. At 6:45 p.m., a whistleblower gets a phone call confirming Agnes has already passed away. The hospital management, though, allegedly wanted the official time of death recorded as 9:30 p.m. That's almost 3 hours later. So you have to ask yourself, why the discrepancy? And that discrepancy, that was just the beginning. The investigation uncovered what looks like a deliberate, calculated cover-up. The hospital didn't just allegedly fail Agnes, they seemed to actively try to rewrite the entire story of her death. So investigators got their hands on two separate medical reports for Agnes, the original and a falsified copy. In the original, you can see the anesthetist wrote dead as the outcome and then scribbled it out. But in the altered file, that outcome is magically changed to referred for ICU/HDU care. This second report also lists a C-section surgery time of just 4 minutes, which is completely impossible. It just shows a frantic attempt to erase the truth. And this brings us to the core, just chilling question at the heart of this whole deception. It's a question that just defies all medical logic, all ethics. How can you possibly refer a patient for intensive care when they are already gone? The cover-up just became more and more grotesque. The hospital allegedly staged a fake emergency referral hours after Agnes had already died. They waited for her sister, Marcy, to show up so she could be a witness to this whole performance. And then they put Marcy in an ambulance right next to the body of her sister and told her that Agnes was just asleep. It's an almost unimaginable level of cruelty. But Agnes's tragic death wasn't just a case of medical negligence. It was actually a symptom of a much larger disease inside the hospital, a deeply embedded systemic pattern of fraud that allegedly touched everything they did. All right, let's talk about the money. This number, 134,400 Kenyan shillings, is what the hospital claimed from the National Health Authority for a so-called ghost surgery, a thyroidectomy that never actually happened on a patient who was one of their own employees. And no, this was not a one-off thing. The investigation uncovered this whole scheme where the hospital used its own staff's insurance information. They would register them for fake procedures, claim the money from the health authority, and in some cases, they'd promise the employee a cut of the money, which, by the way, they often never even received. An ultrasound later proved that the employee named Justice had a perfectly healthy, intact thyroid. And the alleged financial crimes didn't stop there. The hospital was also running a tax evasion scheme. Here's how it worked. They'd pay a small part of an employee's salary through the bank, and then pay the rest in cash. They would then underreport the total income to the tax authority. And guess who got stuck with the consequences? The employee, not the hospital, was the one left facing penalties for tax shortfalls. The investigation makes it really clear that Agnes's death was not an anomaly. Just a year earlier, in 2023, another young mother named Jacqueline Chetnich also died at Systo Mazoldi. And her case shows this hauntingly similar pattern of alleged neglect and total disregard for a human life. In Jacqueline's case, her condition got worse and worse. After a stillbirth, an ambulance was called and it arrived to transfer her to a hospital that was better equipped to handle her case. But according to the whistleblowers, the hospital management refused to release her. The ambulance waited outside for an hour and a half before finally being told to just leave. Jacqueline died just 30 minutes later. So how did all of this finally come to light? Well, it wasn't through official channels or any oversight bodies. It was because two individuals on the inside decided they just could not stay silent any longer. Amos Kiprop and Weekliff Nachubas spent months painstakingly gathering evidence. We're talking falsified documents, receipts, they even made secret recordings. They took all of this information to the Social Health Authority and the Kenya Revenue Authority, and in response, they were met with total silence. Nothing was done. And their reward for trying to do the right thing? They faced intimidation and threats. The hospital management even allegedly put them in an ambulance with the sirens on and drove them to the hospital's lawyers just to pressure them. And when they still refused to back down, they were fired. So what do we take away from all this? This whole investigation really exposes a profound crisis, where the very faith that drew patients to this hospital in the first place was allegedly used as a shield for horrific acts. This quote, supposedly spoken by a hospital administrator named Sister Sophia Redemptor when she refused to refer a critically ill child, it is perhaps the most chilling summary of the hospital's entire ethos. It's a complete abandonment of medical responsibility, just disguised as piety. The child died that same night. This is a complete inversion of medical ethics. The foundational promise of medicine, the one thing they all swear to is, first, do no harm. And every single action detailed in this investigation, the negligence, the fraud, the cover-ups, it all stands in direct opposition to that sacred oath. And that leaves us with this final, critical question. The whistleblowers tried to go through all the proper channels, and they were ignored. The families were deceived. So when an institution wraps itself in the cloak of religion, leveraging all the trust that comes with it, who is there to make sure it answers for its actions? And that's a question that extends far beyond the walls of this one hospital.